whatever would affect a major artery down the line, such as your coronary arteries or your heart arteries, would already start in the penis. So if you have erectile dysfunction, it is a sign that there is cardiovascular issues going on. It's a sign that, for the most part at least, welcome to Dayspring Life and Health Channel. Today we're going to talk about erectile dysfunction. What is erectile dysfunction? Causes of erectile dysfunction. So happy Father's Day in advance to all the men who watch this channel. Make sure to stay to the end to see a musical dramatization of the problem of erectile dysfunction and how it can be solved. Before we go ahead, I just want to encourage you to subscribe to the channel if you are new to the channel, and also hit the like button and the bell button so that you'll be notified when new videos are posted. All right, let's get to it. So erectile dysfunction is the inability to achieve and maintain satisfactory erection to perform sexual intercourse, to achieve erection and to maintain sufficient erection for sexual activity. We also call the same term impotence. According to American Urological Association, estimated to affect about 20 to 30 million people in the United States, which means it's a lot of people who are going through some form of erectile dysfunction or the other. So what are the risk factors of erectile dysfunction? Smoking is a major risk factor, as well as diabetes, type 2 diabetes mellitus, and hypertension. Also, another major risk factor is high cholesterol or hyperlipidemia. The other risk factors are obesity and age. Psychological problems or psychiatric problems, especially as we know it to be depression and anxiety, and other problems including heart disease. The other major risk factor is inactivity, physical inactivity. If you watch our videos on diabetes, you can remember that most of these risk factors are also listed with the diabetes risk factors, especially with physical inactivity. Like we said in pre-diabetes, if we said that if you see pre-diabetes, you have to know there's a sign that diabetes is knocking on the door. So you try to reverse it as much as possible, as quickly as possible. If you want to know that a person is going to have a heart problem or heart disease in the future, then you have to observe how their penis works or whether or not they have erectile dysfunction. So erectile dysfunction basically is a prelude to heart problems or major cardiovascular disease in the future. Because we say this because in the penis, the vascular system there are very minute, very small vascular systems. So any effect on your vascular system or your arteries and your veins tend to show up more in your penis earlier than in your heart. So when you see an effect of erectile dysfunction affecting your penis, it is telling you that down the line you're going to have major heart problems or cardiovascular disease problems. So this person basically said that a way to a man's heart is through the penis. If you are going to have a heart attack, you start from the penis. If you're going to have a major cardiovascular event such as a stroke or atherosclerosis of any major arteries, then you start with the penis. That's what the man said, which is very, very important in this discussion of erectile dysfunction. Whatever would affect a major artery down the line, such as your coronary arteries or your heart arteries, would already start in the penis. So if you have erectile dysfunction, it is a sign that there is cardiovascular issues going on. It's a sign that, for the most part at least, it is a sign that there's going to be a future problem with your cardiovascular system, in particular with a stroke coming up down the line, or a major heart problem, heart attack, or any kind of other heart disease. At some time, a few years down the line, 2, 3 years, 4 years, 5 years, there is going to be a major cardiovascular event. Don't forget to watch the next series of our video. We're going to talk about the causes of erectile dysfunction. We're also going to talk about the drugs that cause erectile dysfunction, and we're also going to mention what kind of foods you should eat to improve your situation. All right, thanks for watching. Beloved, I wish above all things that you prosper and be in health, even as your soul prospers.